time for our students. So thank you so much. And let me tell you that NS is one of the sections of IIT Roorkee, wherein on an average around 300 students join every year. Out of, let's say, 1000 students we get in BTech first year, around 250 to 300 students join NSS. And the motto of NSS is not for me, but for the betterment of the nation. So that with that motto, our NSS team works. And mainly it works on three major areas: environment protection, where for which our students regularly take up different cleanliness drives, not only in the institute but in hostels as well. The second focus of NSS is on community health care, and for which our students regularly visit nearby villages, and they deliver talk to the young school going children. They do organize blood donation camps regularly. In fact, when Professor Pranita Sarangi was the faculty advisor of NSS, she organized several blood donation camps, and I am very happy that in fact we organized one BDC while COVID was at its peak, I think somewhere in June, July. Am I correct, madam?
Yes, yes.
Yeah. So we blood donation camp and other health care and community health care related activities are regularly being undertaken by our NSS team. The third one is literacy drive. Our students go to nearby schools and villages, and they specifically do the coaching for students who wish to appear for, let's say, NEET or for JEE and for other competitive examinations. So apart from these, there are several other activities being done by NSS team, and this is another activity which they have taken up. And I really thank the NSS team and all the experts from PGI Chandigarh, and it's really a great pleasure to have all three experts. In fact, we do organize experts from doctors, but not three at a time. So I hope it would be an excellent session, because you can see there are still, at 156 students have already joined. So we are looking forward to listen to all three of you. So thank you so much once again. And now I would request Professor Pranita Sarangi to take forward this session. Thank you.
Thank you, Professor Barwa, and thank you, Professor Gulati, for giving me this opportunity, and also for the NSS team to taking such a nice initiative to in field of medical sciences, because this since past year we have been so much concerned about health, our immune system, how the infectious diseases what kind of role they play in our life, how they modulate our day-to-day lifestyle. So therefore NSS team has been significantly educating, enlightening, and spreading the awareness of multiple aspect of health and healthcare and related aspect, like in multi-drug resistance, which is a very important concern in worldwide. And to continue the same, they have taken up this webinar on rare diseases, which are the disease which we find in 1 in 2000 individual, and it could range from neurological disorder like Alzheimer, or immunological deficiency, or it could be metabolic or musculoskeletal related diseases, which I'm sure like this term itself, as we hear rare diseases, I'm sure not many of us probably are aware of such disease, and how it could affect our society. So this is a very good initiative by NSS team to bring this into IIT system, where we are so much interested in having a collaborative like effort between doctors and engineers and all innovators. And today we are fortunate to have medical experts from a premier institute of our country, which is PGI Chandigarh, and we have many eminent experts in like a various field which we'll be listening today. So we have three experts, and our first speaker and first expert is Professor Joseph L. Matthew from Department of Pediatric Advanced Pediatric Center, PGI Chandigarh. And Dr. Joseph, his interest is pediatric pulmonary medicine, that is the lung diseases of children. And not just he is a doctor, but he is a very good researcher and innovator. In fact, he has a very well-funded laboratory, research laboratory, and he is also heading the biomedical device hub with many innovations and many varieties of devices. And today he will be enlightening us with the topic general rare diseases. So I welcome Professor Joseph L. Matthew to deliver his speech and increase our our knowledge on these diseases. Welcome, welcome, sir.
Welcome, Professor Joseph. And I also welcome Dr. Rashmi Ranjan Guru. Thank you, Dr. Guru, for joining.
Thank you, sir.
Thank you very much, ladies and gentlemen, and thank you especially to IIT Roorkee and all the enthusiastic people who organized this. And I'm very pleased, especially that the interface between IIT Roorkee and PGI has been our good friend, Dr. R.R. Guru. So Dr. Guru is the glue which is right now holding all COVID activities in PGI in place. So I think he is the right interface for bringing us all together to this platform. On one side, on behalf of PGIMER, I extend you my greetings. And I'm also very glad that we are doing a multidisciplinary kind of an approach, wherein we are trying to touch a little bit into the domains of each other's specialities so that we can work together, for our society and country at large. So thank you to everyone in IIT Roorkee, and also thank you to Dr. Guru for making this happen. So I hope my slides are kind of visible.
Kindly make it in slideshow mode.
Yeah, perfect. So I'm going to touch a little bit about what we mean by rare diseases. And the definition is rather vague. In the United States, in 1983, they said any condition which affects less than 200,000 people in that country would be called a rare disease. And it was also called at that time an orphan disease because drug companies which make medicines for such patients were not interested because they thought that there is not enough business for it. So the US made an act in 2002, which was called the Rare Diseases Act, which was an extension of the Orphan Drug Act of 1983, so that there would be funding opportunities for such things. And then that made private industry interested in this disease. Now, this definition of 200,000 people kind of translates to about 1 in 1,500 people of United States because they have about 330 million population. The numbers are not very different in Europe. They say anything less than 1 in 2,000 is rare. In Japan, it is less than 1 in 2,500. So that is just to give an idea of what this term actually means. But I think more important is if you take a guess, and since I cannot interact directly with the participants here who are online, how many rare diseases do you think there actually are? And I put some numbers over there. This would have been a good quiz, but it is not as small as 770 or 700. There are virtually 7,000 different entities which together form this thing called rare diseases. So it is not so rare or unusual as we think it is. And if you look at just Americans alone, out of the 330 million people, almost 10% of them have got one or the other of this rare disease. And globally, that translates to 30 crores or 300 million out of 6 or 7 billion people. So that is not really a small number. It is affecting huge numbers of people. And then I want to highlight one key point when we talk of rare disease and rare presentation of an uncommon disease. Now, this graph is called the normal distribution curve, which I think people in science are familiar with, including the engineering students at the IITs. Basically, it says that if you have data which is distributed in a normal distribution, you'll end up with a curve like this, wherein most of the people, about 2/3, fall within 1 standard deviation of the central line, which is called the mean. And about 95% of the people would fall within 2 standard deviations. And almost 99.7% would fall within 3 standard deviations. Now, this is important to understand because even in diseases which are not rare, there can be presentations which fall outside this +3 standard deviation or the -3 standard deviation. So that would be a rare presentation, but not necessarily a rare disease. Just like we could have people in whose heights are distributed in these curves, but there would be about 0.5% of people whose heights are way above and whose heights are way below this so-called Gaussian or normal distribution. In other words, rare disease does not include these entities which are rare presentations, but they have to be disease itself has to be rare or affecting small numbers of people. The rarest disease these days is believed to be one which has only 3 cases worldwide out of a series which has been followed for almost 30 years. Now, the problem with rare diseases is that medical science and all of us, what we do, really rely heavily on what is called pattern recognition. So you see the same thing twice, thrice, 2000 times, you gain expertise and experience, and then you start smelling the disease when you see it based on this thing called pattern recognition. Now, in rare diseases, because it's quite rare, there is no real pattern recognition. The scientific knowledge in many of these diseases used to be limited, and therefore diagnostic confirmation using tests and labs is not so easy. And because both of these are lacking, treatment is often limited. And even if treatment is available, because it's rare, it is very expensive, not easily available, and so people have limited access. And because these diseases are generally very expensive to treat, often genetic in origin, lifelong, and life-threatening sometimes, so you need a lot of money investment to make these diseases somewhat controllable. And most countries in the developing world do not have that. So this whole gamut makes it very difficult to treat, diagnose, manage, follow up patients with rare diseases. But having said that, I would like to remind you that when we say rare, it is not necessarily uniform across the world. So what is rare in one country or in one population may not really be rare in another. So the developed countries do not see as many of the infectious diseases as we see in India and other countries. And we don't see as many of the metabolic and genetic problems as they see, probably because we don't have access to the same diagnostic facilities. The second thing to remember is that new diseases always start off as rare diseases. And in this context, I'm showing you a nice curve over here. This curve is actually representing the number of cases of COVID in India. If you look exactly 1 year back, March 2020, we had only 20 cases per day. So that would be a rare disease for India at that time. But over a period of weeks to months, you can see this has gone into thousands and thousands. And so now COVID is not really a rare disease anymore. So 1 year back, it probably was a rare disease. Today, it is not a rare disease. And hopefully 1 year later, it will remain a rare disease. Now, I'm like to highlight to you one respiratory condition, just to give you a flavor of how things work with rare diseases. And it is a condition called cystic fibrosis. Don't bother about the word. Just remember that we in medical science abbreviate this as CF. And most of the patients also know this as CF rather than the full name of cystic fibrosis. Now, this is an inherited disease, which means it is inherited from the parents, etc. And it happens because of a mutation in certain part of the gene. And it affects the lungs and also the digestive system. And liquid secretions in the lungs and the digestive system, which we call mucus, becomes very thick and therefore sticky. And because it is thick and sticky, it goes and clogs the airways and the various tubes, etc. Just like thick sludge can clog our drains, in the same way it clogs the airways and also the pancreas. And this is a lifelong disease because there is no treatment for it. It affects quality of life adversely. It affects survival. And till now, there is no definitive cure on this. Now, why I'm highlighting this disease is that even though people have seen symptoms of this from as early as 2 or 3 centuries back, it first came to be recognized as a different disease in 1939, so less than 100 years back, and it really was a rare disease at that time. Incidentally, the first case reported in India is in 1969 from our institution in an infant who died, and then subsequently autopsy showed this. Now, it is interesting to know what causes it. So in the 17th century in Europe, when there were cases like this, it was regarded to be a curse from witches or some kind of a jadutona type of a thing. And there used to be this folklore which said, woe to the child who tastes salty from a kiss on the forehead or brow, because he is cursed and soon will die. Because children with cystic fibrosis, they have very salty sweat secretions. So their skin tastes rather salty when they are kissed. And so even though people did not know what causes it and they thought it is because of witchcraft, they knew that if a baby or infant tastes salty on a kissing, that child is likely to die very soon. It took almost 250 years, as early as 1949, for it to be recognized as a genetic disease, and then the specific metabolic defect was identified as recently as 1989. So point is, even though this was regarded as a rare disease in the West, now today it is the most common single genetic disease which is there in all developed countries in Europe, Australia, and North America. And these people have done so much work on it that it can now be identified at birth itself, because these developed countries do a screening test for newborn babies when they are born. And so they can identify this disorder right at birth and as required initiate therapy and things like that. Why I'm highlighting this is, let's see what's happening to this in India. Now, in India, we don't have a screening system. And so therefore, we have to rely on clinicians who are familiar with the disease. I mentioned to you that there is a pattern recognition which we follow in medical science. And because that pattern is not frequently seen in our country, so people in the private sector and government sector have a lower index of suspicion. Until about 10 years back, people thought cystic fibrosis doesn't exist in India. Now we are seeing a lot more cases. And because of that pattern recognition problem, other diagnoses which are more common in our setting, like tuberculosis, other lung disorders, etc., they are usually considered first. Now see this chart, which shows you the impact of what is going on. If you look at the bottom over here, left extreme bottom, this shows you this chart basically in our experience from our institution, the age at which this cystic fibrosis has been diagnosed. I mentioned that in the developed countries, the diagnosis right from birth itself. But if you look at our population, children less than the age of 28 days, hardly 1 or 2% of the cases are diagnosed in that age. About 40-50% get diagnosed within the first year of life, but children's diagnoses are often delayed to as much as 8 years, 10 years, and even beyond. In other words, during this time when there is no diagnosis, children are suffering from the consequences of this life-threatening, life-limiting disease. If you looked at the age at which symptoms could have been picked up and diagnosed, and the gap between when they're actually diagnosed, again you see the same pattern. Nearly 1/3 to half the cases are diagnosed much late in our country. And so naturally, these children suffer much more than their counterparts in the developed countries. In India, we don't have the diagnostic facilities for this disease. And I mentioned previously that the sweat of these children is excessively salty. So the simple test which is used is to measure the chloride level in sweat. But unfortunately, this simple test, which is technically simple to do, not at all expensive to do, is not really done by most laboratories in our country, in the hospitals, as well as in the private sector. So therefore, children who can be diagnosed with this simple single test are generally missed because of this. And then, even if they are picked up, cystic fibrosis, because it affects multiple systems in the body and also involves many different parts of the systems, therefore needs a multidisciplinary team which includes pulmonary specialists, gastrointestinal specialists, social pediatricians, and a whole lot of other people. These kind of teams are very well developed in the Western countries, but not so much here. Specific treatment is lacking, and whatever treatments which we can do to support is quite expensive. So many children who get diagnosed and get started on treatment leave this midway because their families cannot afford it, and then therefore they often die because of that. I think last but definitely not the least, and perhaps the most important point, is that there is a limited societal focus. If you think of diseases like COVID, if you think of diseases like H1N1 flu, because of the social media focus on this, even the average layman is now familiar with the term COVID or influenza and things like that, but not so much with other rare diseases, which we will discuss during the rest of the next 40 minutes or so. And this is the one single thing which affects this disease in a negative way in our country and most of the developing countries. Because if society starts to focus on diseases like this, then advocacy from within society, from within non-medical groups, can actually push for better care of patients suffering from these type of disorders. Now, I wanted to show you one important slide, which is the management options which are currently available in cystic fibrosis. This is a slightly complicated slide, but if you think about it, this left panel shows that there is some mutation or genetic defect, it creates some kind of a metabolic problem, and the metabolic problem results in some kind of abnormal movement of ions that causes mucus to be more thick and viscid and sticky because water gets depleted. It goes and obstructs the airways. That creates a condition which is called bronchiectasis, where the airways get permanently damaged, and then ultimately there is irreversible lung injury which causes death. This sequence of events is important to understand because the therapeutic armamentarium which is available in Western countries addresses each of these problems. So there is some limited genetic therapy which is available. There are some modulators of the metabolic defect and the mutations. There are specific drugs which can target the ion transport defects, and there are many other things which can be done, finally ending up with lung transplantation for those whose lungs are severely damaged. But this beautiful picture is spoiled by the fact that the bulk of these specific treatments are not available in resource poor settings like India and others. So we are actually battling this life-threatening, life-limiting disease with very little that we can do to treat it, and most of it is actually not specific treatment, but rather a kind of supportive treatment, rather a kind of management of complications, as opposed to people in the Western developed countries who can actually use specific treatments for this. But even though it sounds very dismal, I think it's important to end on a positive note. And if you look at this picture over here, this shows you a collection of roses which have been shaped in the number 65. And this is because when this disease was being explored in the West, especially United States in the 70s and 80s, there was a funding which was being done through crowdsourcing, which means lay people were trying to collect money to raise money for treatment, diagnosis, research in this particular condition. And cystic fibrosis was not very well known. So one of the children of one of these people who was trying to raise the funds, he kept hearing his mother refer to cystic fibrosis, and he thought actually this word is 65 roses. So because of that alliteration, 65 roses has become the acronym or the layperson's term for cystic fibrosis. And I think it ends in a very nice way because it gives you a positive spin. It also brings a message of hope. It also shows that just like the developed countries did not give up, but used all potential resources, right from legislation, right to lay people's involvement, right to the medical care and the research which went into it, to make a dismal cystic fibrosis something like 65 roses. And I think a similar thing can be done in India as well, not maybe for all rare diseases, but especially for certain specific diseases which are affecting greater numbers of population. So I wanted to just touch upon these brief points in my 10 to 15 minutes. And thank you very much for your kind and patient hearing. Thank you.
Thank you, Professor Joseph. It was a very informative talk on these diseases, and I hope that with doctors and scientists, everybody's effort, even in India, we'll be able to afford a lot of advanced diagnostic and therapeutics in many rare diseases as well. So I would like to mention to all the participants that we'll be taking all the questions at the end of all three presenters talk, and if anybody has any question, they could put it in the chat box, and the coordinators will take questions from there. So next, our second speaker, I would like to welcome Dr. Anju Gupta, who is a professor in the Department of Pediatrics, and she specializes in allergy, immunology, and rheumatology, and she is an expert in neurology, rheumatology, and cardiology. In fact, I was told that she is popularly known among all the resident doctors in PGI as the all-in-one doctors in their institute. And today she'll be talking on primary immunodeficiency diseases. So ma'am, we are very excited to have you here, and kindly present your talk.
Yeah, thank you so much. I'll just start my slideshow. First of all, thank you for inviting me to discuss on this this group of disorders, which is called primary immunodeficiency diseases. Scope of discussion of my talk would be what is PID, that is primary immunodeficiency, I'll discuss a little bit about immune system because this is something which is so difficult for even our own residents to understand. How do primary immunodeficiencies present? How common are they? Then a little bit about diagnosis and treatment, and then about prognosis. So, primary immunodeficiency disorders is not a single disease. It is a group of disorders which involve the immune system. These are extremely rare disorders with genetic basis, meaning thereby that most of the times it is a mutation which is there in our chromosomes, and this leads to an immune defect. So coming to a little bit about immune system, we have various organs in our body which relate to immune system like liver, spleen, bone marrow which produces various cells, then thymus, tonsils and lymph nodes. These organs produce various cells and proteins which are important for immune system. And the function of immune system is basically to recognize and or react against foreign materials. They also protect our own tissues. So both things are important. They will protect us against foreign material. They also protect our own tissue. So what happens in the immune system? So once a germ is there on our body, the first line of defense is skin and mucosal lining. If this line of defense is defective, the germ will go inside the skin or inside the mucosal lining. It is picked up by certain cells which will capture this germ and try to destroy it. This is the second line of defense. If this also is defective, then this germ will enter the bloodstream where it can be destroyed by specialized cells, which are the third line of defense for our body. So in case there is a defect in second or third line of immune defense, we can have primary immunodeficiency disorders. So as I said, that immune defect can occur in any component of immune system. So it can involve various cells, it can involve various proteins which are involved with the immune system. So any component of immune system can cause primary immunodeficiency disorders, and hence spectrum of PIDs is extremely wide. As of 2019, more than 430 different diseases are known within primary immunodeficiency group. Many of them are extremely rare with only few families described worldwide. However, a group of about 5 disorders represent majority of the PIDs which are seen in general population. So now coming to how common are they? French registry basically estimates the prevalence of primary immunodeficiency disorders at 6 per lakh population, and new births, incidence of about 1 per 4,000 live births. This translates into at least 1 lakh serious primary immunodeficiency patients in India at any time, and 4,000 newborns with serious PID being born every year. This is a huge burden for our country, especially because awareness about these disorders is lacking. Diagnostic as well as therapeutic facilities are not available at many centers in India. As we have seen that primary immunodeficiency disorders are a huge group of disorders, about 430 disorders as I have discussed. So it can present at any age. It is not that all primary immunodeficiency diseases will present in childhood. For serious disorders, early childhood or first year of life is the common age at presentation. However, milder immunodeficiencies can present in adulthood. So now coming to how do they present? So as I have already told you that immune system basically works against any foreign invaders, which are usually germs. So these disorders present with repeated infections. And where do they present with repeated infections? It depends which organs or which system is directly related to the environment. So as we breathe air, lungs and sinuses can get involved. As we eat and drink, digestive system can get involved. Skin is a common site because skin is hosts so many bacteria, and then draining lymph nodes. So these are the 5 common organ systems which get repeated infections in patients with primary immunodeficiencies. These infections may not improve quickly as they would in a normal person. Also, sometimes you can get infections in these children and adults with germs which do not cause infection in normal people at all. This is what we call opportunistic infections. Besides infection, there could be certain other presenting features of primary immunodeficiency disorders. As I have told you earlier, that immune system also protects our own tissues. So if immune system is defective, it will act against our own tissue and can produce autoimmunity, where your body is acting against your own organ systems. It can also cause cancers because immune system is important to prevent the growth of cancers. So immune system basically helps to capture and destroy the cancerous cells at very early stage and prevent development of cancers. So now coming to a little bit about diagnosis, you can have certain basic tests. Like I have already told you that there are so many cells and proteins which are a component of immune system. So you can have basic tests which can detect number of cells or amount of certain proteins like antibodies. Further, you can have specialized tests which can detect function of various immune cells. Then the majority of our diagnostic armamentarium rests on genetic tests because majority of the primary immunodeficiency disorders are genetic, and these tests have revolutionized the research in primary immunodeficiency. It is important to understand that in 1990, only 16 immunodeficiency disorders were known, and in 2019, within a period of about 30 years, we now have about 430 known primary immunodeficiency disorders, and new PIDs are being diagnosed every year thanks to the genetic testing, which is so easily available now. So now coming to a little bit about treatment. So in primary immunodeficiency disorders, aim of therapy is basically to replenish the defect. So if your cells are defective, you may try to replenish those cells, or if your proteins are defective, you may try to replenish those proteins which are less. But this is not always possible, especially so with cells. You can understand because cells will not last for a long time. Protein may, if given once in the body, may last for at least few weeks. So no single treatment fits all disorders. To replenish certain cellular defects, children may need to undergo bone marrow transplant. This is especially important in severe forms of immunodeficiency disorders. Then, like I said before, that if antibodies are less in the body, like the body is not producing enough antibodies, which are a type of protein which act against germs, then you may replace this with external antibodies. However, it is important to understand that these antibodies do not last lifelong. So you have to keep giving these antibodies periodically, and this therapy will be lifelong then. If none of these are possible, or if the patient is in the process of undergoing bone marrow transplant, you also need to prevent and treat infections with appropriate drugs. One must need to understand that therapy is extremely expensive. Like for a 10 kg child, if you have to replace antibodies, the cost of therapy comes to nearly 7 to 8,000 per month, and this is going to last for life. And facilities for therapy are not easily available. Coming to prognosis, as I said that, as I've told you before, that primary immunodeficiency disorders are not a single group of disorders. It is a huge group of disorders with very variable spectrum. So severe primary immunodeficiencies can lead to death within first few years of life. Many children we lose within first year of life rather, and mild immunodeficiencies may allow you normal lifespan with recurrent infections. So now coming to why in India there is still underdiagnosis of primary immunodeficiencies. So there is lack of awareness among physicians and public. This is important because immune system, there is so much of research going on in immune system every day, that we are like whatever knowledge was given to us when we were doing MBBS is now almost obsolete, and new discoveries are being made in terms of immune system. So our physicians are not aware about many of these disorders. There are sparse diagnostic facilities. A certain group of disorders we can diagnose only at 2 or 3 centers in whole of the India, which is pretty bad in the sense that India is such a huge country. And then there is lack of coordination among various stakeholders, primarily because immunodeficiency disorders can present to any specialist, be it a neurologist, be it a gastroenterologist, I mean, looking after various organ systems. So immunodeficiency disorders do not respect any organ system like heart or lung or nervous system. So there is lack of coordination among various stakeholders. So what is the need of the hour is a nationwide registry for primary immunodeficiencies. We need to increase awareness among physicians. We have to make at least basic diagnostic facilities available at more centers in India. And we also need to have cost-effective evaluation strategies for at-risk patients so that we can reduce the cost of diagnostic facilities. And also, we need to improve upon treatment facilities because many of these primary immunodeficiency disorders would require lifelong treatment. So with this, I will close my talk and we can take up the questions, I think, at the end of the talk. Thank you so much.
Thank you, Professor Anju. And being an immunologist myself, I could really appreciate how in a simplified language you have educated our students. And I'm sure they must lot of concept which they must be struggling with this pandemic. It would have clarified a lot of their doubts and enlightened them with this primary immunological deficiency diseases. So our last speaker of today's evening, we have Dr. Sucharita Ray, and she is a consultant neurologist at the Department of Neurology at PGI Chandigarh, and she specializes in stroke, cardiovascular diseases, and headaches, central nervous system vasculitis, dementia, movement disorders. And today she'll be talking to us on neurological rare diseases. So ma'am, please, we're open to your talk.
मैम वॉल्यूम नहीं आ रहा है.
Unmute, madam. Kindly unmute yourself.
Am I audible now?
Yes. Very much.
And visible also?
Yeah. Your PPT is also visible.
Okay. Thank you to all the organizers and Dr. Guru for giving me this opportunity. So with this excellent introduction by Matthew sir and continued by Anju ma'am, who have given great insights into these rare diseases as an entity, I thought, and maybe I was right in thinking, that I was wondering how to present it to an audience who's probably not in the mainstream medicine, and the way we, the theoretical approach or the manner in which we communicate with our students. So I have kept it very light, and I've also tried to put in some examples which will basically directed at the students, which will make you wonder to what extent the body is capable of behaving if it goes astray or out of order. So I think the following diseases will help you in understanding, and it's quite fascinating, in fact, to find out the extent to which disorders can take hold of a life and control it till the very end. So rare neurological disorders is going to be my presentation. It's not working, I'm sorry. Okay, so like Dr. Matthew said, what constitutes a disease? We already know that a rare disorder is defined which has a prevalence in less than 1 per 2,000 population oddly. And you would still be interested to know that irrespective of this very relatively small number of population that it appears from theory, actually when you talk about the amount of budget that is expended on all this, it's quite a significant amount. And a big chunk of that research money actually goes to the development of orphan products, that is making drugs for which no return is possible and for which probably no benefit to life is available as a huge level of evidence as compared to some of the common diseases. So most importantly, when we come to this rare disease as an entity, every student who enters into medical school immediately begins, especially in the sophomore year, if you have read some medical novels, you would find out that once the student enters medical school, they would be interested in finding out all rare presentations or all rare diseases in whatever patients they see. But one of the first things we are taught is the law of commonness, which basically shows us that uncommon presentation of a common disease is more common than the common manifestation of a rare disease. And this is usually put into our heads right from our career as a student, even till our present situation when we practice it ourselves, and we also tell our students to keep this dictum in mind because it makes many things easier. So which way I'm going to present? It is going to be in the form of audiovisual media. So know that photography is truth and cinema is truth 24 times per second. This was told by a famous Swiss filmmaker. So I'll be giving my examples today in terms of pictures, in terms of videos, because I, as a child or as a student, always felt that these few evidences that I received from cinema as a child or as a student was much more useful in my early years, formative years as a student, as a resident, to give you a perspective of medicine the way it was. My students don't see so much cinema, good cinema I mean to say, and I still impress upon them the need to do it because it tells you life in so many beautiful ways if you pick up the right ones to see, and it teaches you a lot. So I'll be discussing these cases in that order. So this is one very common, condition that everybody knows. Lorenzo's oil. It is there for this acute adrenoleukodystrophy. It talks about. It's a true story of a family whose son Lorenzo O'Donnell at 7 years began to experience loss of memory, started falling down, loss of hearing, did not see, could not remember, and gradually it progressed. And during this time, at this time, like Dr. Anju also discussed about this inherited immune disorders, there was this panel of research which was done over his disease, and it was found out that he had one of the rarest form of disease, which manifests in early childhood, and that was found to be known as adrenoleukodystrophy, basically causing accumulation of some sort of a disordered group of fats in the body. And once that accumulated fat or accumulated in different parts, it became pathological. It used to cause almost any manifestation affecting any organ part of the body. So these two parents, played brilliantly by Nick Nolte and Susan Sarandon, actually found out some alternative medication that's beyond the purview of our disease. But this is one of the seminal works that is still asked to medical students right now, even in our teaching courses. And this disease needs to be known, because whenever we find so many children coming, especially men, because it's an X-linked disease, and so the men will be affected and the women are carriers, and they come to us with all these deficits and almost any form. Some of them can even have refractory shock because of involvement of the adrenals, which prevents the formation of adrenaline in the body, giving us this blood pressure head to maintain our posture. So when you have these diseases, the MRI looks literally cooked from behind, and very less hope of survival. genetic counseling is on, and so many work and research is being done for this patient, these kind of patients, and it's still in the throes. So this is one of those good movies to watch probably, and a nice disease to know, because you will be surprised at the spectrum of presentation that it can have, not just in children, but also in adults who can present with this deadly condition. This is a man whose life story was so tragic, Joseph Merrick, who was born with this completely normal child to his parents, and at around 6 or 7 years of age, he started to have weird overgrowth asymmetrically from different parts of the body, sometimes a piece of bone protruding from the head, a piece of muscle coming out from the back, and deformity of the face, so much so that he actually got himself secluded for the bigger part of his childhood. He stayed confined to the hospitals until finally he signed up himself some sort of a as a showman in a freak show. So if you know that, you know, in the colonial times, there would be these circuses where people with gruesome and grotesque body deformities would be hired for people to do, to come and see, visit, marvel, comment, and have good times. That I don't know how it happened, but it did. And he was one of those rare presentations of this person until he became famous shortly before his death. He had a tragic life. So with some sort of a disorder that made almost disordered growth or disordered protuberances coming from any body tissue, causing severe seizures. Literally, his skeleton became deformed over a period of time. You can look at the panel given on the right. So his appearance was as grotesque for him to be called as the elephant man, because not just his face, but his skin and you know, the flesh resembled that of the trunk or the hide of an elephant. Thick hide, thick muscles, and lobulated appearance, half of the face deformed. And he was later on, you know, came to the social circles, kind of became a celebrity, but you know, his head became so overweight with weight that he would literally keep on sleeping with his head bowed forward. And the only time he probably tried to sleep like a normal person with his head on the pillow, his neck got dislocated from you know, the rest of the spine, and he died at the tender age of 28. So this is the case of elephant man suffering from this rare condition called Proteus. Now Proteus is a bacteria where we, you know, from where etymologically we derive the word protean, which means almost any possibility. So the Proteus syndrome is one of these rare syndromes which is caused which causes the overgrowth of almost any body part and can have any manifestation in any organ system. This is a good movie. Bollywood sometimes makes good movies, and this is one movie that dealt relatively okay for a condition which is very common, but because it is picked up so rarely by teachers or by family members themselves. So basically it's when you would have this multiple vocal tics or movement like grunts, like coughing, clearing of a throat, that develops in a child. So most of the times it is present in a very subtle or a very gentle form in children. So we try to think of it as somebody who's just having a habitual motor act, which is completely voluntary, and we just think, yeah, it's like his personality. But it is not. It's basically a complex genetic disorder due to incoordination in the motor and the emotional control system of the brain. It has been brilliantly portrayed in the film. I would expect the students to watch it because it's quite well portrayed by Rani Mukherjee, who's probably done some good movies in other medical conditions also. So one of the striking features of it is coprolalia. So when the children, they grow, if they have a full-fledged Tourette syndrome, they talk absolute rubbish and take not pleasure, but it is almost disinhibited speech consisting of foul speech and disrespectful language, and which is almost continuous. And remember, it is not because of bad education or you know, bad character of the child, but something which is a genetic disorder whose treatment is actually very difficult, and it needs to be it basically needs to be seen and picked up by teachers and by friends and also by family members to be able to be investigated. Sometimes it can present itself as a spectrum of many other conditions also. So this is something that is also quite an interesting neurological feature. This is a picture that literally drove the living daylights out of me when I was an intern. So this is called The Others. It's one of those very few movies which won an Oscar and were also selected for a Goya, that is a Spanish film festival. I think it got nominated for that, even as an English language film. So it talks about a mother with her two children who stay in this house enclosed by dark curtains, and the entire movie is obviously a horror movie, but it's a splendid portrayal of the fear and the horror of children who must be prevented from being exposed to sunlight come what may. And they throw weird neurological symptoms like seizures, like hallucinations or abnormalities in behavior. And movie is great, but this basically is an entity that is called photosensitivity, which is seen in many conditions which start also from childhood, and which is also seen in adults. And there is a spectrum of conditions like allergy that is presenting as dermatitis when children or people get exposed to light. That is very common disease called, not common, but I mean, it's commoner than we think. So basically people presenting with cheek being flushed and rashes coming when they're exposed to sunlight, and sometimes very rare disorders that can progress on to have deformity of the skin, with people gradually being deformed to such an extent that you can't even recognize what they once were. So xeroderma pigmentosum is probably the condition in the movie. It's not been told, but you have this plethora of photosensitive conditions where people have destroyed the quality of life by undue exposure to sunlight, and they must be prevented because it's basically the UV rays that penetrate the skin and they set up these atopic mechanisms. A lot of these conditions are prone to cause internal cancers, and they can have many varied presentations. Some of them are extremely disfiguring, and the scars are going to be there for a lifetime. If children have read Alice in Wonderland, as a child, they would know each time Alice would, basically go down a long tunnel before she sometimes finds herself growing out of proportion to the house, or having a hand that is bigger than a rabbit. I don't know how many of you have read Alice in Wonderland by Lewis Carroll, but this description that has been given multiple times in the book, where there is a change in the proportion of body sizes, sudden increase in the size, sudden disfiguration of things that are perceived, or the way things look. So this was not known to be a disease entity. It was initially thought to be a flight of imagination of the author, until later people actually started to present with these complaints to the doctors. And upon describing, so the Britishers or the common folk who had read up this book gave descriptions very similar to what was in the book. And this is caused by multiple conditions. In children, it's the most common cause is epilepsy. In adults, it's very underreported, but patients who have migraine in adults, who have again photosensitivity, who want to be away from the sunlight, often sometimes find out distortions that usually they don't report. So this is very commonly seen in migraine in adults also. And then you have some other demyelinating conditions and other rare conditions where you see. So this is basically not a rare disease, but it's a rare manifestation of many common diseases. And unless and until you speak about it, you ask for these hints, you would never get it from people. It is so rare that it's probably been told maybe 200-300 times. And you have migraine is so common, it is almost present in 25 to 30% of the general population. But there are certain conditions like this Alice in Wonderland syndrome, like visual snow, for example. So these are some of these. So visual snow is a syndrome. It's an extremely rare symptom where the person perceives the entire foreground as a static condition that comes when the TV channel is not running. So such rare symptoms are also precursors to understanding neurology, because they give you a disorder in the way people perceive the environment, and how the vision, the way the coordinated manner in which the vision needs to work in order to be able to perceive things as they are becomes completely distorted. So hardly 200-250 cases have been discussed about it worldwide, but I think that we don't really ask about it to our patients, because we see these patients dime a dozen and going on and ranking the patients for things like this is time taking, and it's extremely inconvenient for some people who work in an overloaded emergency or OPD. This is a movie that I would ask all kids to see. I am yet to see it myself, but I'll play the video. So just watch what is happening to his left hand. So basically in this small trailer, his left hand is not working as he would like it to happen. So this is called alien limb syndrome or Dr. Strangelove syndrome, where one of the body parts, usually the hand, acts as if it doesn't belong to the person and the person has no control over it. And a lot of times the hand actually goes on to do acts just opposite to the intended act or what is being done by the opposite hand. So you have multiple causes. Very commonly, it is seen in one of the degenerative diseases like CBGD that we see in our patients, in elderly patients. They come with part of the brain gradually deteriorating, and you can also see it sometimes after surgery or in tumors, even stroke. So depending upon the different locations where the insult occurs, basically it occurs when so whenever there is a movement of any body part, it needs to have a control or a communication with the planning system of the brain, and especially when the planning is intentional or it is voluntary. Now, if there is a disconnection between the center that generates the movement and the center that generates the intention or the systematic way in which the movement has to occur, the movement becomes disinhibited and usually goes opposite to what is intended. So it is a disorder of the sensory system, and often times the patient or the affected individual does not get the input of what is happening with the abnormal hand. So this is one of the very rare manifestations of alien limb, which is again a very rare manifestation of multiple diseases which are very common. But this is an interesting sign when it comes to us, because as medical students, children are known to pick this sign up because it gives you a faint idea of where the damage is occurring in the brain. And it is very useful in pinpointing diagnosis in some cases. These are some of the rare causes that I told that students would like to know, but this is one condition where doctors have been extremely, they have devoted their lives to the study of this man. He's basically a medical marvel who went by the name of Phineas Gage. So in the picture, you see him with this rod that he was holding. So this is actually the rod that blasted into his skull when he was at a quarry doing a mine blasting exercise. He was a foreman there, and suddenly with this explosion, the rod went into his head and punctured the skull part, moving out literally half of the brain, moving one eye out, damaging many structures inside the brain. But so much was the miracle in I would probably say miracle, anything short of that would not explain, because despite this huge structure passing through his brain, he is reported to have not just been alive, but throughout conscious the entire journey from the place of mine blasting to the hospital, and continued to be conscious throughout until he died 7-8 years after this incident as a consequence of epilepsy secondary to the trauma that he had received. So this gave an opportunity of doctors to study him throughout, because when this particular part of the brain was damaged on the left side of his body, so his personality, they were able to find out what deficits came in him. So what were the functions? Retrospectively, they started to know what were the functions of the damaged part of the brain, which were not displayed by this person. Even after he died, 7 years after he was buried, his body was exhumed by scientists. And the images that you see on the right were due to the tracked imaging of scientists, which was done on the body to give a reconstruction of the fibers which were affected. So scientists have been at him for so many years. He is literally a legend in the medical field for understanding the nature in which the brain works. this is a recommendation I would give to all students, all people who would be curious to know about more and more rare conditions. So talks about children like who were born autistic. Now almost everybody knows autistic form is something which is a severe form of mental retardation in children, genetic almost, but some of them have got exceptional abilities called savants. So it talks about them. It talks about a man who confused his wife for a hat, literally, because he was not able to interpret what he saw. Then it talks about basically a sailor who was completely lost regarding his past memory. He thought he was stuck in Second World War, and there was a person who fell from the bed and thought that his leg is not his, that there is a dismembered leg on the bed. So curious and extremely rare phenomena of so many of these conditions are described in this brilliant book by Oliver Sacks. One of these conditions is probably experienced by Sacks himself when he was a student. So if you want to know about this fascinating aspect of how the brain works, I will recommend this book to you. As Dr. Anju herself has said, you should know that there is, in truth, there is no one specialty in medicine unique from the other, because all the important diseases that man should be familiar basically have their manifestations in many organs. This was told by Sir William Osler, and there is no bigger truth than this. Thank you.
Thank you, Dr. Sucharita. Indeed, it was a wonderful presentation, and I'm sure it must have been really exciting, and student must be curious to ask many questions to you. And we had this after 3 wonderful medical-based knowledgeable talks, which was again possible because of Dr. Guru. I would again mention him that we could not have had this without his support and his guidance. And now I would request our General Secretary Harkira to continue with question answer session. I don't want to keep the participants waiting to get answers for their curious questions.
Yes, sure. Thank you, Professor Pranita, and thank you all the speakers as well. We can move ahead with the question and answer round. There was one question for Professor Joseph that chloride test in sweat is simple to do and not that expensive, but since the disease associated with it are rare, it is not installed. So is there any channel or something which could create awareness for such easily deployable devices, or how can it be done? Which I think Professor Joseph has answered in the chat box itself. So if there is any follow-up question by the participant, you can please ask. And I would also request everyone to please go through chat box as well. There have been very much interesting links put up by Professor Joseph for everyone to go through and read a lot about these rare diseases and other disorders. Coming ahead to the next question is, how prevalent are immunological deficiencies in Indian population, and how does our government help these patients? So I think, Dr. Anju, this question is for you.
Yeah. So see, there is no data still. That's why I have talked about a nationwide PID registry. So we don't still have data about prevalence of PIDs. You have to understand that primary immunodeficiencies can go to various specialists. It is also important to understand that there are not too many centers where we are able to diagnose primary immunodeficiencies. So we still don't have data. These are projections which I have taken from a French registry, which is talking about prevalence and incidence of primary immunodeficiencies. So at any time, at least 1 lakh patients in India would be there suffering with serious, clinically significant primary immunodeficiencies. There are certain primary immunodeficiencies which do not cause too much of trouble. I am excluding all those. And then incidence of about 4,000 newborns with primary immunodeficiency born each year, and many of them would be dying within first year of life if they have serious primary immunodeficiency. So that is the issue with primary immunodeficiencies. Primarily, major work is going on only in Mumbai and in PGI. There are certain other centers which are coming up, but right now the facilities for diagnosis as well as for therapy are very sparse in India, and we are probably losing too many patients without diagnosis.
Okay, thank you very much, Dr. Anju.
In this context, it's important. I wanted to add one sentence. In most countries, and especially in India, the key to making something good happen for these people with rare diseases is not likely to start with government effort. It always starts as a civil society effort, particularly if there are influential people involved, either as sufferers of the disease, or they can be brought on board to help the people who are suffering from this disease. And then usually government effort comes in later on. This is unlike if somebody very powerful in the political arena or something has got one of the rare diseases, in which case then of course focus shifts to that. In the West, they use civil society, crowdfunding, layman initiative. Media is a very big partner in healthcare, and all these disparate bodies come together to then work together to make things happen. Similar thing can happen in India and is already happening for some of the rare diseases. Thank you.
Thank you very much, Dr. Joseph. We have one more question, I think, which might apply to like each of the speaker. That is, do you think the growing field of genetic engineering can help in prevention of these rare diseases, as most of them are genetic disorders? So
I think it's absolutely correct. Genetics is going to play a lot of role in diagnosis as well as in management. So that is where I think we are still behind the West. So genetic diagnosis as well as genetic therapeutics by genetic engineering would help. There's no doubt.
And yeah, Professor Joseph has also mentioned like it's a new ray of hope for treating these diseases. So there is one more question from someone who has like sent it to just me, not to all the participants. That's the, for the skin disease albinism, is there any way in medical science to reduce its effect in eyes, which is also caused due to this disease?
Personally, I don't have experience with this particular disease. We will have to read up, or we will have to talk to somebody in dermatology and ophthalmology. That means skin specialist and eye specialist who may have better experience. And I think I speak on behalf of all the three of us. Most of us would not be treating like this. But if required, we'll find out and try to get back to you.
Okay, thank you very much for your answer. There are some questions which have been just sent to me. That is for Dr. Sucharita. Why X-linked diseases affect men, and how prevalent are X-linked neurological diseases?
See, if you talk about the karyotype, that is the genetic makeup of men versus women, we have 2 X chromosomes in women and 1 X and 1 Y chromosome. So obviously when, if the disease, most of the diseases that we know are X-linked recessive, that is, there is a recessive trait which is present on one of the X chromosomes. And in the female, if there is one of these chromosomes is having this trait and the other one is normal, then this recessive trait tends to be suppressed. So she will not exhibit the chronic signs or the full-fledged signs, but she will end up being a carrier. That is, one of the ova produced by her might carry the diseased chromosome. On the other hand, in case of a male, if that single X chromosome that he is having has the disease, the other one is Y, and there is no healthy X chromosome which can suppress. Occasionally you can have what we know as, so if the healthy X chromosome of a female is not sufficiently capable to suppress the disease trait, it is called lyonization, Lyon. So in these conditions, the females not just act as carriers, but can exhibit to some extent some of the features of the X-linked disease. So that's for the recessive. We have very few X-linked dominant conditions also, in which case both men and women, more of vitamin D resistant rickets is one very common example of X-linked dominant condition. So in that, men and women exhibited equally.
Okay, thank you very much. And the next is that, is there any difference in the genetic rare diseases when we consider North or South India, or maybe North or South hemisphere of the world as well? I guess this would again be a very general question.
Yeah, it may be variable. So it all depends on which kind of disease you are looking at. See, genetics is what like Dr. Sucharita was also telling you, that there are certain X-linked disorders. There are certain autosomal disorders. That basically means the disorders which are related to any of the other chromosomes except X and Y. So if there are autosomal recessive disorders, they are going to be high if you are marrying within the family. So within a community, if marriages are occurring within a community, these disorders are more common in developing countries, because consanguinity is far more common in developing countries. In developed worlds, you won't see those many autosomal recessive disorders. So there is definitely like in certain South Indian states where marriages are happening within the family, you will see more commonly genetic disorders, certain kind of genetic disorders.
Yes, so moving ahead, I guess the question for Professor Matthew, what is the effect of climate change and air pollution on CF? That's the disease which you talked about.
They are having adverse impacts. So bad climate, pollution, worsening of the lung condition. So CF children's lungs are also worse with these things.
Yes, so I guess if there is any other question from any participants, you can please use chat box or Q&A. I think we can wait for a few moments for any other question. Yes, I think, oh, there is one question, that is, how common is leprosy?
It's very common.
Okay, so and
It's
the
not
next question.
genetic. So
Yes, I guess one more question, like as we are moving towards renewables and nuclear energy is a major part of it, but it also creates radioactive wastes. So do you think that nuclear energy can result in higher occurrence of these rare diseases? So I guess it's quite a general question to.
it basically depends on just your disposal of the nuclear waste. So if your waste disposal is not accurate, then mutation rate is going to be definitely high.
Yes, and Professor Max has also
So it is
mentioned nuclear.
basically like in Hiroshima and Nagasaki, they got like that after that bomb, they are seeing a very high rate of mutations even till now. So it all depends on your disposal of the nuclear waste, and if their accidental exposure is occurring at any time, like due to various accidents.
Okay. I'm not sure, like this one question, like national policy for treatment of rare diseases has been kept under a BIA. I'm not, I guess has been kept under abeyance for revision. So what I guess this question is incomplete. So really not sure about what the participant has to ask for.
I'm sending the link for the National Policy on Rare Disease of India 2020. Yeah, that's the link.
you very much, Dr. Matthew, for the link. And I think now we have no more questions. So finally, now I would like to invite Professor Rachita Gulati, Faculty Advisor, NSS IIT Roorkee, to present concluding remarks for the session.
Thank you, Harkat. So, very good evening to our guest speakers, participants, colleagues, and everyone gathered here. On behalf of NSS IIT Roorkee, it is my privilege to propose a closing remarks and acknowledge the team's contribution who have really worked hard to make this webinar on an intriguing topic of rare diseases successful. I offer my thanks to our guests and renowned experts in their profession, Professor Joseph Matthew, Professor Anju Gupta, and Dr. Sucharita Ray for sharing their experiences and enlightening the attendees with the updates on the extremely relevant and rarely known rare diseases to the attendees. My gratitude to you for sharing your views and extremely thankful for sparing time at such a short notice for being here with us today. I am thankful to Professor Mukesh Barua, Deans of Student Welfare, who spared his time from the busiest schedule to enrich the session today. This session would have not been possible without his support and the support of the Student Welfare Office IIT Roorkee. I sincerely acknowledge his support to on behalf of the team. I acknowledge the joint effort put up by Professor Pranita and Dr. Guru. So without whom we could not have been here today and sharing discussing this really important topic of rare diseases. Lastly, I am grateful to all the participants who have joined us to make the webinar a meaningful event. Thank you all for getting today here. And thank you to all the professors who are with us from the PGI. Thank you.
Thank you, Professor Matthew, Professor Gupta, Dr. Ray, and Dr. Guru. Thank you so much.
Thank you.
So we can end up now.
Yes.
Yes, Dr.
Thank you very much, everyone.
Very much.
PGI and IIT together. I am a person who is the link between the two institutes.
Yes.
I'm
Thank you very much, Dr. Guru.
Barua sir and Nita ma'am, Rachita ma'am, Joseph sir, Anju ma'am, Chinta ma'am. So I'm feeling very happy.
Okay, thank you.
Thank you, Dr. Guru.
Thank you, everyone.